Hi, welcome to part 2 of chapter 20, Fainting, from the Merck Manual of Health and Aging. Let's get right to it because we got so much to talk about in so little time. What is fainting? Well, it's a sudden and temporary loss of consciousness. A person who has fainted cannot be aroused for several seconds to several minutes. Before fainting occurs, people may experience sensations of lightheadedness or heart palpitations. It could happen for anyone, but it's especially dangerous for the elderly. What causes it? Well, there's a lot that causes it, but it's mainly the principles of two things: a lack of oxygen to the brain, or a lack of sugar to the brain, or a combination of both. Specifically, a drop in blood pressure, cardiac pathology, stroke, carotid sinus syndromes, atherosclerosis and anemia, and seizures. Now, seizures are rare, but they're still a factor of fainting. There's a few things that can affect the decrease of blood pressure. One is aging. As we all age, our body deteriorates a little bit more and more. Now, the natural decrease of blood pressure is a factor of that deterioration. There's less blood flow. There's le- uh, there's a less rate of red blood cell replenishment, and so forth. So that's a natural risk or a natural factor that increases our risk of fainting. Some prescription medication have side effects that increase fainting. When you couple that with the aging factor, that could be a big problem. Beta blockers, antidepressants, ACE inhibitors, and diuretics are all common prescription meds and non-prescription meds that can decrease blood pressure. Orthostatic hypotension, you're getting up for a great day, you're ready to go and hit it hard, and then you're like, I'm going to drop to the floor. That is orthostatic hypotension. Your body isn't responding as well to the changes in blood pressure, and there isn't that blood to the brain is diminished. That's not as big of a deal for us, the younger generation, but for the older generation, that's a real thing. Postprandial hypotension. Thanksgiving dinner is over. You just had the most wonderful meal of your life, and you go to get up, and all of a sudden you're super lightheaded, and you're like, I gotta take it easy. That's postprandial hypotension. Your body is focusing all of its blood supply to the gut to digest all that food, and there's not as much in the head, and so there's that risk. Again, not as much of a risk for younger generation, but definitely a plausible risk for the older generation. Dehydration. If your blood doesn't have the viscosity it needs to push itself through the body, it's going to be really hard to get to the head to provide the nutrition that the brain needs. Straining during a bowel movement, those pressures can decrease your overall blood pressure. And vasovagal syncope as well, another one for a risk of fainting. Now, what's carotid sinus syndrome? The internal carotid bifurcates in the neck, and at that point, just a little bit higher, are baroreceptors. Those physiological receptors are one of the body's ways of detecting high blood pressure. Now, if there's pressure on those baroreceptors at the carotid sinus, your body kind of freaks out, and it's tricked into thinking that there's a systemic high blood pressure. So it goes in and it says, open up the gates, make everything bigger, and let's decrease this blood pressure. What that causes is a lot of problems. Vasodilation causes a decrease in blood pressure, and that can cause fainting. Things that cause that: tight collars around the neck, or the certain movements from the neck, like our super grandma. Everyone's got them, who they're on the phone and they're cooking and they're cleaning and they're holding the grandkids and all these wonderful things and probably running a marathon all at the same time. And that pressure on the sinus just causes them to drop. Carotid sinus syndrome. So how do we diagnose this? Most of it's in the history. We're great history takers. We can ask the right questions to find out what's causing the fainting. Prevention is the name of the game. So if we can figure out what's causing it, most of the time we can figure out how to prevent it. So, what were you doing just before you fainted? How were you feeling before you fainted? Does anyone in your family suffer with this also? What do you remember? Have you started any new medications? Perform a physical and neuro exam afterwards, after your history. Blood pressure vitals can help you test for orthostatic pressures, as well as any medication related low blood pressures. Heart exams could help or will help us as practitioners to identify heart pathology. Cranial nerve exams will help us rule out strokes. Blood tests for anemia, hypoglycemia, ECGs, and EEGs to help monitor the heart and the brain, especially for seizures in the brain. Safely recreating a syncopy event like the crud sinus syndrome could also help us identify the specific reason our patients and loved ones could be fainting. Now, like I said, prevention is the name of the game. If we can understand their history, we can understand how to help them and how and what counsel to give them to prevent fainting from happening again. The main rule is if you feel faint from doing something, do less of it or none of it. Some causes of fainting, though, can't be avoided, such as heart pathologies or medications. So it's side effects from taking specific vital medications that they need or have been prescribed by their primary care physicians. After taking medications, though, they can lie down. That's something we can counsel them to do. Also, counseling them to avoid high blood pressure medications right before a meal is also a good idea. That way they can sustain that pressure throughout the meal while it digests, and then they can take their high blood pressure medication. Drink plenty of fluids. I cannot talk about how important this is. If your blood doesn't have that viscosity, the water helps lower the viscosity so it can smoothly circulate throughout the body, taking all the nutrition it needs to every single tissue, not just the brain, but in this case, especially the brain. Increasing salt intake. This is an interesting one because, yes, it decreases the risk of fainting, but it also increases the risk of heart disease. What do you want? Well, the best plan of action is to consult with their primary care physician about it. There's some other advice here. Orthostatic hypotension can be resolved from this advice here, as well as avoiding alcohol and diuretics because it can dehydrate the body. And then low impact leg exercises can help with the leg pump to get blood pumping through the body more efficiently. The last thing we have here is treatment. Based on the cause of fainting, the underlying principle again is prevention. Wearing high waist compression stockings, raising the head of the bed, and increasing their salt intake with the help of their PCP could help them really overcome orthostatic hypotension causes. But if those measures aren't working as well as we want them to, there are some prescription medications that can help. And this is my favorite picture of the whole presentation. This lovely lady, could be suffering from a heart problem. Well, if it's an abnormal heart rhythm or chronic sinus syndrome, our lovely friend here would need a pacemaker. According to the book, there's lots of surgical solutions to decrease the risk of fainting. If she had a heart attack, she would need a coronary bypass surgery. If she had a heart valve issue, the heart valve would be replaced. And if she had a stroke, they would do another surgery called an arteriectomy, which pretty much gets in there and it cleans out the middle of the artery so that there's more space for the blood to flow through. One thing we could help this lovely, happy lady do is our supplements. Vitamins and iron supplements can greatly increase the ability for red blood cells to regenerate. Thank you for watching this review with me. I hope you guys are all doing well and staying safe and healthy during this time of pandemic. Have a great day.